They usually commonly tested. Like I said, you have to know the mechanism, the side effect, and then they say in consideration. The first group that I want you to know um, is what we call loop diuretics. So they are the loop diuretics. Well, why do we call them loop diuretics? Because all of these act on your kidney. And so your kidney, if this is the kidney, like that. The filtrating system of the kidney it's a different system, right? You go into glomerulus, collecting tubule, and a loop of Allen and a collecting tubule. Basically, this is the loop of Allen, and this is the collecting tubule. So these diuretic act in a different direction. The loop of Allen act on the loop itself, and therefore, there's certain things you have to know. First examples. Common one is furosemide. We call it laces because he can last for 6 hours. Another one that people forget is this bumetanide. If they don't um, ask you loop diuretic, specifically furosemide, watch for bumetanide. It's the most common. Otherwise, they may give you something that look like furosemide, right? Right? Torsemide is the same thing. It can also give you acetazolamide, right? These are all specific, but yeah, I don't want to put this one here because this one you will see it in like a ophthalmology question. So it's a little bit confusing when you're talking about ophthalmology. That's the loop diuretic you should worry about. But for cardiovascular, you deal with furosemide, bumetanide, and torsemide. These are the three, and the main function mechanism is they're going to block, okay, sodium. They block sodium at the loop of Allen. So when they block sodium here, by the time the urine get to the collecting tube, there is no sodium. Your body doesn't like you to lose sodium. So in the process, they exchange sodium with potassium. So actually, you're losing sodium and potassium, but the basic effect is you lose more potassium than sodium. That's why it causes um, kalemia in the end, but the main function is to block sodium. They also block chloride, and then in the process, you lose water. So they're very good for diuresis, right? So those are the things I want you to know about. What side effects that the body is going to ask you. Sometimes you got to make these things easy so that you don't have to memorize it. Side effect, where if I'm losing a lot of water, my blood pressure is going to go down, hypertension. And this is usually orthostatic. So you teach them to get out bed slowly. That's all. That's the teaching. That's the complication associated with it, right? The second one, if you give it too fast, IV, it can cause autotoxicity. That means if you're going too fast. So the next thing you do, slow it down. That's all, right? It can cause dehydration, right? Those are the things. It's a sulfur drug. So what's sulfur drug? What is things you're supposed to know? Stephen Johnson syndrome, they will say small um, purple rash or popular rash on the chest. That's Stephen Johnson syndrome. That's a priority. Another thing they will ask you is sunburn. This is photosensitivity. This is not the priority. So photosensitivity is not a priority, but Stephen Johnson, it is. Like I tell you, number one priority you should know is hypokalemia because that's dangerous. So that's something that you should be aware of. It can decrease sodium. If you give it with lithium, it can increase toxicity. How? Because it decreases sodium. That's how. So we don't combine diuretic with the lithium. It can cause problem. And if you take NSAID, you make it ineffective because NSAID causes fluid retention while diuretic is trying to get rid of it. So this is a few things you need to know. This is IEL fact you need to know about diuretic, example of them. What are the side effects? What are the common side things you should see? and straightforward, right? Nursing consideration. Well, monitor the individual potassium. You know that, right? You got to monitor the potassium, slow the infusion down so that you can prevent autotoxicity, right? And tell the patient to increase intake of what? Fast. I call them, these are potassium intake, which is what? Easy way is fish, avocado, right? Spinach, and tomato. Of course, there's banana, there's orange, and there's orange. You tell the patient to eat. But easy ways to know fast. So those are the things you have to know for this medication. So the second group is thiazide. These two very, very important. Thiazide are very important. Example is hydrochlorothiazide. And if you don't know, you should know this clothianidin. Because if they don't give you hydrochlorothiazide, they'll give you clothianidin. They have functions to inhibit mostly sodium, right? But it's not that effective compared to a loop diuretic. Um, the key side effect, I tell people to memorize this: hypergluc. That means what? H and the gluc, the G, hyper G, gluc. The G is glucose, so hyperglycemia. So if diabetic, it become a problem. Your glucose go up, your lipid goes up, lipidemia. It increases your lipid level. Uric acid. If you have gout, you're going to have a problem. And C, calcium. Your calcium goes up. So these are side effects related to thiazide. Of course, what is the priority? Number one, hypokalemia. Same thing as what? Loop diuretic. So hypokalemia is the biggest side effect. And it's also a sulfur drug. So it causes Stevens-Johnson syndrome and photosensitivity. That's all. That's all you need to know about this medication, right? You don't have to beat around the bush, just straightforward. Go with the content. The other group is potassium sparing. Okay, so K sparing, I call them. Example is spironolactone. But don't know just that. I want you to know this, pyrenon. Or if you can, try amiterine. Going to block aldosterone. Aldosterone, what is that? When aldosterone usually causes increase what? Sodium and decrease potassium. If you block aldosterone, that means your Ka up and your sodium down. This is how this medication causes hyperkalemia. So up and the K is up and sodium is down. So it causes hyponatremia by hyperkalemia. So those are the side effects of that medication. Of course, since the diuretic, it causes hypotension. But one side effect of spironolactone is gynecomastia, developing breast physically. So that's what you see is due to steroid. Yes, some steroid effect. Good. So gynecomastia. So that don't forget about it. This is specific to spironolactone. What do you teach them? Too much potassium, right? Therefore, avoid the fast. Avoid the fast and then banana and other thing because he has too much potassium and monitor their potassium. They should also avoid ACE inhibitors and ARB because they lead to potassium retention. Okay, and they should avoid what? Salt substitute. Salt substitute is like people, instead of eating salt, they think they to increase their sodium because they are on salt restriction. They don't want to eat salt, so they substitute it with salt substitute. Salt substitutes contain mostly potassium. Therefore, if you take a potassium-sparing drug and you increase your salt substitute, that means you're increasing more potassium. And that's the key factor by these three medication type. For your board, I want you to know these little things in addition. Okay, these are as the extra bonus information to know what is that. There's some interactions that can occur. So I already mentioned some of them. If you take the Johnson and you had like a loop or ACT Z, is not good. It can become toxic because of low potassium. So that's number one you should avoid. Diuretic two, you should avoid diuretic in somebody who is taking lithium plus lithium because toxicity, because of what? Low sodium. So you shouldn't take it. If you take diuretic, you should not take NSAID either, because NSAID what does NSAID want to do? You want to retain fluid, and diuretic want to get rid of it. So a counter, basically decrease effectiveness of the medication. So that's something you have to pay attention to. I guess I'll use something you have to pay attention to that they may ask you, drug interaction. Um, for the symptoms that they mostly will ask you is this: hypokalemia. And what are you looking for? Muscle cramps. Look at the word muscle cramps is the key. Or they may have some weakness or arrhythmia, maybe mostly PVCs. That's what you're looking for. If it's hyperkalemia due to spironolactone, you're going to see muscle also weakness. It's mostly weakness than cramps. So muscle weakness. And then when you look, you see peak T waves. If it's hyponatremia, because your sodium is low, you're going to have seizures and confusion. So those are the symptoms that you may see in your exams and confusion. Mostly if it's related to hyponatremia. Okay. And these are the things, if you know them, most diuretic questions is going to be easy. So what do you do? If you see a patient who has what? Muscle cramps, patient has a muscle cramp and some weakness, and he's on diuretics, where I'm going to check his K to make sure potassium is not that high. If you have tinnitus and you're getting loop diuretic, where I'll slow you down. If you have hypertension and you take diuretic, I'll check your blood pressure, right? Those are the things you have to know for these diuretic. They're very short, but very straightforward information. They like asking it because it's very common. And thank you for watching.